Dad, what is diarrhea?
Well, son, diarrhea is characterized by frequent loose or watery stools. It is commonly classified into acute or chronic. Any other question?
Let me think. Oh, I got one. Dad, what are symptoms of diarrhea?
Well, symptom of the diarrhea can be when you have soft, muddy, or watery stools that may be accompanied by abdominal cramps, bloating, nausea, and dehydration. Any questions? Any other questions?
One more. What causes diarrhea?
Well, as previously stated, the causes include infections, food intolerance, allergies, medication, and chronic diseases.
Another
Any
question.
questions, son?
Another question that I have. What complications of diarrhea?
Well, one of the main concerns with diarrhea, son, is that you can be dehydrated, especially in children and the elderly. It is important to replace lost fluids and electrolytes when you have diarrhea. Any other question?
Main one is, how do you treat diarrhea?
Well, depends. It depends on the causes. You use multiple modalities, but one of the common things that they use is called a brat diet. B stands for bananas, rice, R for rice, A for apples, T for the bread diet. It is often recommended for mild cases as these foods are easy to digest. And some of the things you can also do include probiotics you can use. Those are supplements, and you can also use fermented food to help reduce the gut flora and speed up recovery and the cases of antibiotic-associated diarrhea.
Another one of my questions, Dad, is how do I prevent diarrhea?
How to prevent diarrhea? Well, you need to use good hygiene practices, safe food handling, and avoid non-food intolerance that can actually prevent diarrhea. So if you're intolerant to lactose, you do not use that. And did you want to know about acute versus chronic diarrhea?
Yeah.
Well, acute diarrhea, the difference between acute and chronic, acute diarrhea typically lasts for a few days up to 14 days and is usually caused by infections such as bacterial, viral, food poisoning, even medication side effect. And the symptoms usually include not just the watery stool or muddy stool, soft stool, but also abdominal cramps, nausea, and vomiting. And to manage that, thank God it usually resolves by itself with rest, fluids, and sometimes over-the-counter medications. You want to know about chronic diarrhea?
Yeah, that sounds nice too.
Well, chronic diarrhea usually persists for more than 4 weeks. And causes of chronic diarrhea actually are different from acute diarrhea. Causes of diarrhea, chronic diarrhea may actually indicate more underlying conditions like inflammatory bowel disease, irritable bowel syndrome, celiac disease, or other malabsorption issues. So symptoms of chronic diarrhea are actually similar to acute diarrhea, but may also include weight loss, fatigue, and malnutrition. And how you manage chronic diarrhea? Well, the management of chronic diarrhea requires a thorough evaluation by a gastroenterologist to determine the cause and the appropriate treatment plan. And usually the treatment plan include prescription medication, once you figure out what caused the diarrhea. And sometimes they can recommend dietary change or other therapies. Now, any question? Any other question?
When I have diarrhea, when do I go to see a doctor for it?
When you want to see a doctor, well, it is important to seek medical attention if the diarrhea is severe, persistent, or accompanied by high fever, blood in the stools, or signs of dehydration like fatigue, tiredness, and sleepiness. Thank you so much, my son. You have very interesting questions. And if anyone wants to know more about diarrhea, please do not hesitate to contact Cadet Solutions or Health and Infectious Disease Care. This is Dr. Francois Cadet, infectiologist or infectious disease specialist, and this is
Zayden Cadet.
Thank you very much for listening, everyone. Ciao.